Hello, Cam followers. I'm sorry we're a couple of minutes late, but it is great to see you. I have got the lovely Amy King here with us tonight to talk about something that I know many of you will want to know more about, because managing cruciate disease is a big topic and that many of you guys will have to experience, sadly, because it is the most common cause of pelvic limb lameness in the dog. And many of you guys will be going to surgery. Many of you guys will be trying to manage it conservatively. But Amy is here to hopefully give you some guidance and answer any questions you have. But first of all, I want to tell you all about something very, very important that is happening in CAM. We have got the big walk is back. We did it last year in 2021. It was a raging success because we could meet all of you guys from around the world. It's basically a big fundraising event for CAM, but it's also a way that we can actually teach about arthritis in a fun, innovative, funky way. We want to bring you together as a network. We want you to socialize with each other whilst learning. So please do go to our website and look about the big walk. And if you're a company that's thinking, oh, that's very interesting, then please do get in touch, because we've still got space for some more sponsors. So I'm going to put that away. I will put the link in the notes, or the lovely Lynn might actually do it for me. She's amazing. Amy, tell everybody about yourself.
Hi, everyone. Thanks for having me. I am an ACPAT physio, and I work at a clinic in Wellington in the UK called the Wing Clinic. So I went and did my physio degree and qualified in 2012, which is 10 years ago now. And then I went back and did my Vet Physio MSc and got my PG dip in 2018. Started working with animals, did some horses, did some small animals, and now I very much am just a small animal physio with maybe a couple of horses on the side. And then I went on to do a research project, which I did completed last year. So now it was on hypermobility in dogs. So trying to see if we can come up with a bit of an idea of whether it's there and what it looks like and how we assess for it and what the implications are. Wow. My research didn't incorporate all of that. It was just sort of getting the ball rolling, really.
I tell you who else was doing stuff. I think I'm right in saying David Levine was looking into
really?
it. Yes. I might connect you to.
That would be really great.
Yeah, he I'm sure that he mentioned it a little while back. Anyway, that's interesting.
Yeah. Very closely linked to arthritis as well. So.
Yes, exactly. And explain why, so people understand that. The cat, sorry.
So
jumping on my leg with its claws. Yeah, explain to people why.
So we know that cartilage has got some quite complicated roles. It's not just a passive material that sits in our joints. And the hyaline cartilage is the cartilage that covers our joint surfaces in all of our joints in the body. And it responds really nicely to compressive forces, but any shear or rotational forces can start degenerative pathways, which then cause degenerative joint disease and arthritis.
Yep.
So if you've got hypermobility and everything is moving more than it should do, you're more likely to have those kind of forces. Not necessarily, but you're more likely to. And that can then cause that secondary joint disease.
I love it because it just, I don't love it in that I would hate it to happen, but I think it's amazing that we're realizing how many things come to the common pathway of degenerative joint disease. Mm-hmm. And I was saying to somebody earlier, it's very unlikely you're going to avoid it. If you own a dog, definitely if you own a cat, you are very, very unlikely to avoid having to manage OA at some point in your dog's lifespan. So just another contributor, like a risk factor, hypermobility. So let's talk about what we're going to talk about tonight, which is management of cruciate disease. And first of all, I just want to give people a little bit of a lowdown why this is important. As said, cruciate disease is the most common cause of pelvic limb lameness. So if your dog is lame on a hind limb, really need to be checking cruciates. Another thing to think about, if your dog is bilaterally lame, people often think hips, but still check the cruciates because it's commonly a bilateral disease. We know that many of these cases, if the first stifle goes, the second one will go in a period of time. I think about 40 to 50%, it becomes a bilaterally unstable condition. So it's really common. As said earlier, many dogs will go down a surgical pathway, which is now considered gold standard, managing those abnormal forces. However, many people aren't in that position to go down the surgical route, and a conservative management plan is the only option. However, what we're hopefully going to talk about tonight is that a physical rehab approach to both will hopefully get better outcomes. Fair to say?
Yeah, definitely.
Cool. So are you happy to just quickly run through what the causal factors of cruciate disease is, what we believe, and I'm going to let you kind of flow.
Yeah, so I don't think we understand fully what all the causes of cruciate disease are, but it's slightly different to the kind of pathogenesis or the cause of it in humans, in that tends to be pretty much always traumatic, whereas in dogs we think there's a genetic and degenerative element to it as well. But certainly it does tend to be that when we have that acute onset of lameness that we associate with cruciate ligament rupture, that we do, there has been like a preceding trauma. So whether that's like chasing a cat or running after a ball or putting a foot down a hole or something, there tends to be that final kind of straw that breaks the camel's back.
Yeah. And we have that all the time. I would say at least 50 to 75% of the cases that come in with cruciate damage, not necessarily full rupture, but maybe partial rupture, the owner really does believe it's an acute injury, that there's no preceding signs. The other horrible condition that I have to mention, not because I'm trying to generate fear, but I'm trying to make people be observant, is osteosarcomas. People come in with an acute destabilization. No, they really didn't see it coming. And there's been a bone tumor that has just gone. And it's a bit the same with the cruciate. It degenerates and then goes.
Yeah.
So yeah, that's exactly what I see in practice.
Yeah. And I think that often there might be a partial rupture beforehand, but dogs can compensate pretty well and manage to kind of hide those for a while if you're not really looking out for them.
Yeah.
So I would say, I don't have any research to back this up, but I suspect that the majority of partial cruciate injuries don't get picked up, and we don't see them until they become that really acute lameness. And then when the cruciate is completely ruptured, or more than 50% of the fibers, the dog then really cannot stabilize when that foot is in stance. So when they are weight bearing, they cannot manage that glide. And I saw a paper that looked at video fluoroscopy of how much movement is happening in the stifle, and it can translate by 9.7 millimeters or something, which is horrible. And so as the limb is coming through swing, the dog hyperflexes to try and stabilize it whilst it's in the air. But when it's in stance, it just can't manage that instability. And that's when it's getting that glide and causing that inflammation and pain. And that's why often you'll see that really short stride. You'll probably see quite a lot of rotation while the foot's on the floor. And then in particularly sore cases, they're non-weight bearing.
Yeah. And I think it really was brought home to me how much they can hide. They don't hide. I hate that word. How much they can
tolerate. It can be. Yeah.
And they tolerate and get on with life. Lameness in the hind limbs. When I was using a stance analyzer, and you'd put a dog on there which you really didn't feel when you watched it walk in was going to be that bad. And you're like, wow, I didn't see that coming. And they might be able to offload from 20% of weight carriage, which they should have on each pelvic limb, down to around about 6 or 7. And you're like, wow, you know,
You didn't look that bad.
Yeah, it didn't look that bad, especially if they're bilateral as well.
Yeah.
So, okay. And then when I mentioned earlier about management approaches, it's interesting talking to therapists, because when you talk to an orthopaedic surgeon, it's very much surgery. And when I talk to physical therapists, they're like, yeah, we can get some good results with conservative management. You know, where's your stance on that?
So for the most part, we can get some pretty good results with conservative management, but with cruciate ligament ruptures, if they can have surgery, I would always recommend surgery, just because even if it's really, really carefully managed, that stifle is always going to be unstable under load.
Yeah.
And that is always going to cause inflammation, joint changes, and pain, likely to lead to secondary meniscal tears and things. And I think you can manage it very carefully, but that dog is always going to have reduced activity levels, and it's not it's going to be quite restricted long term. And I would have said actually that bracing is a really difficult thing to do for stifles, and I've not really met anyone who's gone, yeah, we've had great success with stifle braces, we love those. But actually the CNAPs have done some research on that and shown some really good outcomes with stifle braces. So actually using these kind of, I think they're like grade 4 hinged casted braces, but they've had some really good outcomes long term. Having said that,
cool.
Yeah,
I heard them lecture probably about 3 years ago at one of the Veterinary Osteoarthritis Alliance events, and he went into great detail about what braces were currently available, and he just really hadn't found one that he felt was a safe, reliable, tailored one that was getting good results. So it's really fascinating how much has progressed in the last 3 years. That's brilliant.
yeah. I'm going to try and find out the date of this research now, and then I can tell you when they did it and if it was after the last 3 years ago. It would have been 2016.
All right, okay, yeah. Well, it'd be good to see what their thoughts are, because I know at that one he was saying it's, you know, there's a lot of products on the market, the braces that are currently available, and they're marketed very well, whether they're actually delivering what we need, that real proper stability at stance, because they can't mimic, you know, the hinge and rotation, and they're very hard to get one that's really tailored to the individual. And the ones that are available are tailor-made, aren't they? So they are pretty pricey,
and they're about £1,300 for one stifle brace.
And it's not we're trying to put people off. I think what I would really like is, if people do want to go down the brace route, to consult with a vet physio team to make sure that you are doing the right thing for your dog. Have you had many people spend a lot of money on braces and then come to you for support thereafter, and you go,
not for a stifle brace, no. Oh, sorry. I just wanted to just the braces. Not for stifle braces, because I think I've always tried to encourage surgery. However, I mean, so we have had one that was sort of conservatively managed, but and I think, you know, for some dogs that's the only option, isn't it? They can't have surgery because of comorbidities, or because of age and the risk of the general anaesthetic, or because in some cases because financially it's just not an option. But in these kind of older ill dogs, their activity levels are pretty low already, often. And actually then kind of setting up a program to manage it and looking at all the factors, so home environment, activity levels, pain management, therapy, you can manage them quite well. But you don't expect them to be able to go back to sport, off-lead running, that kind of activity. Would you agree with that?
No, I totally agree with that. But what I do love is the fact that we're talking about it, because I definitely have felt in my time in first opinion practice, people feel if they turn down surgery, they turn down everything. And it's like I've taken a pathway to go it alone. And I'm sitting there, no, you don't need to do
At
that.
that point, you need people more than ever.
Yeah, exactly. So shall we tackle like conservative management? I know that you don't do it frequently, so I'm not expecting you to come out with this amazing array.
I think actually a lot of it is the conservative management and the non-conservative, like the post-op rehab. There's a lot of crossover.
Yeah.
Especially in the more acute phases post-op. So yeah, no, I think that would be good to.
Yeah, let's do that, because I will always remember one of my heroines, Laurie Edge Hughes, saying in one of her seminars, if you're not able to offer a conservative management plan to your cruciate disease, then shame on you. Because it is true, there's a really big proportion of owners that will not be able to afford £2,500 for a TPLO or a TTA or an MMP or whatever surgery is preferred. And shame on us if we do not say to people, actually, I can still help you. I've got a 12-week plan in my head. Let's see how we get through this. I'd like to introduce you to Amy, my local physio, who's going to hold your hand and take you through the conservative management plan. So if we start with conservative, much of it will be repeated into surgical. So let's start there. Just imagine I've come in and I've got my Rottweiler. He's a bit overweight.
Great.
Yeah, he's a bit overweight. But luckily his elbows are fine. So that's a good thing. And he has got, unfortunately, he has fully ruptured his right stifle.
Okay.
But you can feel that there's a buttress, and you can feel there's also a buttress on the left. So there things afoot in both limbs, and acute deterioration in the right. And the owner says to you, I wish I could afford it, but I can't. How can you help me?
Okay, so I think the first thing we would do is find out if there's anything else going on. So assess for any kind of secondary complications. Are they struggling with back pain because they're trying to offload their hind limbs? And just get a good initial picture for how comfortable that dog is and what you're dealing with. And then also, I'd want to know a bit more about what you're doing with that dog at the moment. So what's this normal routine like? Do you live with other dogs? What's your home environment like? What's the flooring like? Are they up and down stairs several times a day? Because I think the first thing we can do, probably the most important, but sort of the most simple, is manage their exercise and manage their home environment. So really, really big things are... and I think a lot of the stuff that you guys already push as part of the canine arthritis management is what sort of flooring your dog is on. Because if you've got that movement in this unstable stifle that your dog is already struggling to stabilize, on a slippy laminate hardwood floor, that's going to be much worse. You're much more likely to cause flare-ups, and we're going to escalate that disease process.
Yeah. And I think people forget that if something hurts and then you put something that hurts on an unpredictable surface, you're just going to really tense up. And I always liken it to, say you've got a bit of an ankle injury and somebody says, hey, let's go ice skating. You'd be like, no, I don't. I'm not going to do it.
Absolutely.
And you'd go out and everything would be proper panic-stricken tight, wouldn't it? In case you slip, and then you can do further injuries.
Yeah, but even just walking on a slippy pavement, if you've got knee pain, you just don't want to do it.
No.
Yeah. Let alone an unstable knee, just a sore one.
No, absolutely. So we've got, I've come back to you and said, do you know what? I've been following Cam, and I've just invested in a load of rugs around my house. I've put a baby gate up. He's not jumping in and out the car anymore, and he's doing lead walk exercise. To be honest, I don't know how much to do. I'm trying to do what's sensible. He's tending to walk on a pavement or flat grass of the local playing field. We're probably going out no more than about 5-10 minutes at each occasion, because he seems to really start getting a bit sore. And even within 5 to 10 minutes, I can see that he's limping more than he did at the beginning of that walk. And also, to save you time, My vet told me he's carrying too much weight and I've got him on a diet. And you're like, okay.
Great. Yeah,
So,
I'd be giving you about 6 brownie points, some gold stars.
thanks.
Yeah, perfect. So all of that, managing carefully at home, limiting his exercise. So then at that point, we'd need to know what sort of pain management he's on, because he's still quite sore going out. Is he on any pain meds? So I would probably have a little look at him, make sure that it is a stifle, which probably is, and get in touch with your vet and say, I think this dog's really sore. What are your recommendations for some pain management, and is there anything else we could be doing?
So I'm going to be 2 people. So I'm now the vet.
Okay.
I'm getting to role play my arse off here, aren't I? So as the vet, I've said he's already on a baseline non-steroidal. But thank you so much for letting me know. And your report was incredible. And I read it every single word.
Several times, yeah.
Several times. And I take on board what you said. And I believe that the most appropriate thing is to add an adjunct analgesia with a long-term focus on it. So we're looking at probably being on a background chronic pain medication for a few months. But because you are describing quite super sore at the moment, I'm going to put in maybe some paracetamol just in the short term, with the hope that you, as the therapist, are going to start using amazing magic. So hopefully the therapist, using their amazing magic, will be able to complement my pain relieving regime so that I can start phasing away my pharmaceuticals. But in this situation, I'm sure that we both agree the most important thing is we get pain under control, because we're not going to get anywhere. And it's a real joint effort between vet and therapist. So they come back to you a week later, they've got the adjuncts on board, they've been using, say, some paracetamol maybe 3 times a day, and they've started to see that he doesn't offload within that first 5 minutes. He seems brighter. They're actually having problems holding him back. You know, he's really taken a good step in the right direction, but he's still really wonky. He's still, you can see that he's still not got a great gait. He's not trusting of that limb whatsoever. What next?
So at this point, this is where we start doing our physio stuff and get him using some appropriate muscle groups, try and start to straighten him out a little bit, see if we can encourage some careful loading without changing the range of motion in that knee, and look at how well he's stabilizing and coping with that. So a really important muscle group with cruciate injuries is the hamstrings, because they insert behind the stifle. So in theory, the hamstring muscle could do a similar job to the cruciates, but we know that when something is painful, all our muscles pack up and go on holiday a little bit, and especially around the affected joint. So starting to reintroduce some activity is really important there. And we would start with isometric muscle work, and isometric just means using a muscle when it's not changing length. So for example, some weight shifts to get some weight on that leg and just encourage some muscle activation as they start shifting onto it, and looking at the dog's posture. So seeing if we can start encouraging a normal sort of more like neutral spinal posture, because often if they're chronically or even really acutely lame on a hind limb, they tend to offload forward. And then you start getting flexion of the back and tightening on the other side, where they're shifting the weight over and fixing on the good side, if they've got a good side. And that can all be quite uncomfortable, but also it means that then you don't get nice muscle activity in the hind limbs, which you're trying to wake up and switch on again.
Perfect. So as I've got a kind of like a budget where I can see you probably once a week for maybe the first 3 or 4 weeks, and then I'm really saying to you, I need to kind of push this down to every 2 weeks, or even maybe every month. So in this first appointment with you, and you've done all this kind of assessment, and what could an owner maybe expect in that they've got 45 minutes, an hour with you?
Yeah. So we would get some baseline scores, like I said, for what the dog's clinical picture looks like at the start, and then we would try and treat that dog using manual therapy, electrotherapy. So Classically, if you've got a CCL dog, they're hanging on through their hip flexors and everything's a bit tight and sore, and releasing that can make them feel quite comfortable straight away, because to some extent that will be contributing. And then using things like laser can help manage that inflammation and pain as well. Things like biomag for managing muscle spasm.
Yeah.
And we also have an Indiba here as well. Very lucky to have that. And that obviously can have a really, I say obviously, like everyone knows what the Indiba is, can have a really positive effect on soft tissue healing and managing joint pain and muscle pain. So I might be doing something like that just to try and manage the pain as effectively as we can whilst everything's less sore. We try and switch everything on to try and make everything as strong and stable as we can. And I would provide like a progressive program for strengthening to try and so that as he can do one bit, then you can progress on to the next bit with some guidance to make sure everything's looking good and he's managing it nicely, to get to a point where the dog is as strong as we can get them.
Yeah. So let's go back about the tools that you have, because I think a lot of people don't realize how skilled physios are, because you have an array in your toolbox, and quite often you whip out another magic tool and people are like, oh, where did that come from? So just explain. So we've got laser, you mentioned, pulse mag and Indiba. So can you really briefly, like an elevator speech, just describe what each of those modalities are? And then me being Mr. Practical Head, is all they're doing is trying to promote the body's own healing processes. So just tell what the different things are.
So laser is, we use a grade 3 laser here, but there are grade 4 lasers or K lasers. Our laser is a cold laser, so it essentially uses light therapy to promote cell activity. So if you've got tissues that are struggling, the laser will support them basically, and in doing that, it promotes healing, reduces inflammation, and improves pain. Mm-hmm. And the lasers have got better penetration depth than using something like LED, like the Fertizo, which a few people have at home. And actually, I know we're not talking about it right now, but the Fertizo I actually think is a really nice thing to have if you're managing something like a cruciate dog long term, because the stifle is relatively superficial, and the Fertizo might well help manage some of that kind of pain and inflammation, and it's something that you could do every day, every other day at home with your dog. So the laser is kind of in that ballpark of photobiomodulation.
Yeah. And then they go to a physio or a vet and they think, but it's the knee. Why is she treating the back? I think actually that's a really sign of a skilled therapist, is to go, I know you want me to treat the area of concern, but actually my eyes are elsewhere, and the cause of your dog's discomfort at the moment isn't just the knee, it's here, it's here, it's here. And I'm using it on, say, trigger points. I'm using it to improve blood flow and relaxation. And yeah, I love it when people kind of tangent off and owners go, it's his knee. Yeah. It's also, it happens when you're a vet, because you always look at the good leg first, and the amount of times people go, it's his right line. You're like, I know. Yeah. But you always feel an idiot. You always feel like you've got to really justify yourself. Like, I know. Yeah.
But don't upset him until I absolutely have to. So that's the last one.
Leave that one till last. Yeah. So what about pulse mag? Just a bit, again, elevator speech on pulse mag, and then Indiba.
So that is a electromagnetic field, and you can do it pulsed or continuous, and that basically helps with circulation and blood flow. So they used to use it for recovery after races and greyhounds and things like that, and now it's kind of become quite popular in like muscle and joint pain management.
And it's becoming more freely available, but I think they
I think the pulse mag or biomag and the Fertizo, the LED stuff, are the two kind of most affordable things for owners.
Yeah.
The lasers are a bit more pricey, and the Indiba is expensive.
Well, tell us about
Then
Indiva.
kind of clinic based. So the Indiva is radiofrequency electrotherapy, and basically that means passing a current through the tissues that you're treating, and the depth of penetration for that treatment is much higher. And it does similar things. So it helps with soft tissue and joint pain. It helps with healing, promotes stem cell activation, and can also affect like the A delta fibers that are involved in chronic pain pathways. So they're nice tools to have at our disposal. And I think the Indiva, definitely we're seeing some really brilliant results with in terms of management.
And I think it's good that people start hearing about all this stuff, because there's definitely a wish to step away from pharmaceuticals. But what I really want people to take home from this is it's about using all the tools in your toolbox. And it might be me. I'm now being Rottweiler owner again. I've been to see my vet. I'm on a background non-steroidal. I've got an adjunct there because the dog really didn't like its stifle being touched, wasn't happy to place on it at all. So we believe it's essentially sensitized. So we've got adjunct medication there. We're using the paracetamol because we had quite an acute situation. It was really quite sore. But what with the help of Amy and these other modalities and exercise management and lifestyle management and weight loss, we prematurely come off of the reliance on these medications. And that's what we all want, working as a team. So brilliant. So the Rottweiler lady is so super happy. She's bought you a box of chocolates, and she's disappeared for about 3 weeks. And she's come back and she's been doing all of her exercises. And the dog is actually doing really well. What can she expect for the medium term and the long term? So I'm priming you to say you're never out of the woods, love. You've always got to have things. So sorry to prime you, but medium term.
Right. Yeah. And you're right. So, it's basically living with their condition. So the stifle is not stable still. We've just got it into a better situation than it was in, and we can expect flare-ups. And I think that's the case with any kind of orthopedic condition like this. Elbow dysplasia, hip dysplasia, cruciate ruptures. We can get them looking good, but as with any kind of long-term condition management, there are going to be flares. And sometimes it'll be really obvious what's caused that. So it'll be like, oh yeah, we were doing really great, and then he jumped out of his skin when someone shut the door behind him, and I think he twisted it. Or sometimes it'll be like, we haven't changed anything, but he's really sore, and that's just a really normal part of the journey for managing joint conditions.
Yeah.
And what we should be able to do is go, well, we know what works, so we just need to kind of have another look, treat, and hopefully we'll be quicker because we've spotted it sooner, and we've managed to get him in a good place before this happens. So I think it's empowering owners to be able to pick up the signs of when something goes wrong. What are you looking out for? And I think in cruciates, sometimes they might not be really obviously more lame to an owner, but they might then, he has been sitting quite nicely, but now he's sticking that leg out to the side again. Or when he's eating, I noticed that toe is kind of trembling on the floor, or he's licking that foot quite a lot, or, things like that, just to start being a bit more aware of when we might be dropping off the perch again.
And I think that's brilliant advice. I'd like to add to it, and it goes across the board for cruciate or OA, is we really need to be teaching owners that acute flares happen. They happen. That is how the disease presents itself. And we really need to give people the equipment to go, I'm having a flare. This is going to be 7 to 10 days of hell, but I will come out the other side. And I need to spend a little bit of time thinking what happened in the previous 48 hours that possibly triggered this flare, so that I can learn and avoid it. Might be, as you say, jumping out the car or having rough and tumble with a friend or overdoing it at the weekend. I'm going to have my little toolkit to get me through the flare, which might be increasing medication, adding medication, resting, lead walk, distraction toys, kongs, licky mats, lots of scatter feeding around the garden to keep them kind of. And then hopefully we'll come out the other side and learn to avoid that trigger in the future. And it's exactly what you're describing, but that is universal for all OA cases. If I was the perfect Rottweiler owner, would you like me to continue?
Sure, you would be.
I would be, obviously. Would you like me to continue on a plan that you've created, or do I come out the other side and go, enough of Amy, never need to see her again?
Well, I hope no one ever feels that way. I think, yeah, you're right. So we would need to continue with things long term, because especially like little flare-ups will cause associated weakness, which then will cause little setbacks. So always doing stuff that is going to help to improve proprioception, which is joint sense awareness, and to try and maintain muscle mass and stability. And I think also doing those exercises helps you to see those subtle changes as well. Because if they can do those and they're doing them nicely one day, but then they start to not want to, disengaging, or they're visibly struggling, that's a bit of a flag. But yeah, you do need to continue with them. And I think, to be realistic, even the very best Rottweiler owner isn't going to be able to do those exercises every day for the rest of time. So I think doing them, maybe having a break, then going back and seeing if we can still maintain them and if we've kept that level of fitness and mobility. And maybe coming back for kind of quarterly reviews just to make sure that nothing's changed, maybe changing up some of the exercises for a little bit of variety, or actually just to kind of be a bit of a prompt. I know if I go to a class with my dog, I start doing the training with him again a week beforehand and then pretend I've been doing it the whole time. And it's a bit like that, isn't it? Just makes you a bit more accountable. So yes, it's long-term management, but I think we have to be realistic about what we expect from ourselves and our dogs.
Yeah. No, I actually, do you want me to do my confession? So Luna has her own like exercise plan, because my last dog got lumbosacral stenosis, and I'm absolutely determined to maintain her lumbosacral like stability and strength. And yeah, I wrote out a whole list.
Brilliant.
How do I get to do it? I am airhead and always busy, so it happens to all of us. It really does.
Just pop the list under her food bowl while she's eating and just see if she can, by osmosis,
perfect. I'll put it under a pillow. Yeah. But that's something that I really hope that in the next 5 to 10 years, across the board, all vet practices in the UK give owners more exercise advice, because I think it's actually quite easy. I've been playing with one of the software programs, and every owner that comes in for an OA consult, I say to them, would you like me to do a little exercise plan? And it starts basic, and if I see that they follow it, then we keep adding to it. So if you're an owner that really wants guidance about exercise, see the likes of someone like Amy, find a vet that's got an interest in rehab, or a nurse that's got an interest in rehab, and they can start guiding you to a greater detail. Okay, so let's now move on, because some of this is going to be overlap. What about a dog that's come in post-surgery? And this time I'm going to be a Labrador owner, and my Labrador's a perfect weight, actually. Really nice rib cage, really glossy coat, nice defined waistline, and unileg. So actually the other leg surprisingly doing very, very well. There's no evidence that I've got any problems there. And it was quite an acute rupture, and I decided to go for a TPLO. Got in there quite promptly and started as I meant to carry on. And I've come to see you quite promptly at my vet's advice. So it's, let's say, 2 weeks post-surgery. And amazing. Yeah, I know. I'm so good, aren't I? 2 weeks post-surgery, and I've been doing my homework from the vet. I've kept on the lead, little toilet walks only. And I've also, believe it or not, been icing the knee 3 times a day, because I'm very dedicated. Pain management's pretty good. He's absolutely fine with me touching in and all around his stifle, and he would love to do more, but you know, I'm very in check. I've come to see you. What happens?
Great. I mean, that's really exciting for us, because I think a lot of the time we see post-op cruciates quite a long way down the line. And at that point, if they have lost stifle range of movement, then we really struggle to get it back again. So seeing a 2-week post-op cruciate is really great. And I think you're right. He's doing not very much, and that is fine for the first few weeks. I know it's frustrating for owners and dogs, but actually the first kind of 4 to 6 weeks, particularly whilst everything's healing, is our window to make sure we get good flexion, and by that I mean bend, in that stifle. And if we've flared it up a bit and we've got a bit of swelling in there because they're doing too much on it, then we really struggle, and then they don't get as good outcomes. So that's my biggie. That's my initial goal.
Big tip.
I want to get a bend back in that knee, because if we don't, they can't sit properly, they can't lie down properly, and then they always offload onto the other side when they're pushing up to get standing or running or going. And then if they're doing something like jumping up or sprinting, again, we're loading a stifle that's not happy to bend, and that's going to cause problems.
Okay, so massive take home, guys.
Yeah.
Post-surgery, have your eggs in order. Know what you're going to do. I think my biggest tip would be have a consultation with a physio before you go to surgery. You know, have everything in place for your post-op recovery plan. It's worth it.
Even if it's a phone call. I know every physio would be happy to have a chat pre-op and get a plan in place for post-op.
Yeah, I think it's because I'm like the ex-smoker of the vet world, in that I've made every mistake. And I look back and think of all the times that I could have advised better, but I just didn't know. I really honestly didn't know. And I do think there is information regarding this area very, very lacking in vet advice, because we're just not taught it. So big take home, you're lined up to do surgery, speak to your vet, ask if they recommend a physio locally, have a conversation and get that plan in place. So great. I've come to see you 2 weeks, and you're really, really quite pleased that there's not a huge effusion. Great. And I've got a pretty good range of motion. There's no clicks. There's no withdrawals. If to say this is really sore, please. Seems really quite comfortable with being handled in and around the knee. So there's no fear of touch. And when the dog places weight on it, it's pretty good. You know, you can see that they're still worried, you know, a bit fearful, but there's really good weight placement. What happens then?
So at that point, we start very similarly to where we would start with a conservative management. So we are doing pain management. If they're really struggling and they need to be on pain meds, from my point of view, as a physio, I'm happy for them to be on pain meds for as long as they need to be in order for us to get a good outcome from that surgery. And often some of our dogs will be on some sort of non-steroidal anti-inflammatory for 6 weeks. Yeah. And as long as the vets are happy with that and there's no sort of contraindications to it, I think that's really important, because like I said, maintaining good movement is the most important thing. And if they're comfortable on it, they'll use it more and we'll get better muscle activation, and recovery will be faster, and circulation will be better, and swelling will be less, as long as we're not doing too much. So it is a balance between encouraging them to use the limb and not letting them overdo it. Yeah. So we would be looking to increase how much they could do, but probably not really more than kind of 5 to 10 minutes. I don't know what your kind of post-op programs are like.
Yes, that sort of thing. It's very, very slow increase. And something I wanted to add, sometimes you have owners that they're almost a little bit competitive with themselves, aren't they? And getting off pain meds is a real sign of success.
Yeah.
And you feel that they're super keen to get off the pain meds. You're like, whoa, slow down. It's okay.
No rush.
It's not bad. Do not rush it.
Yeah.
So I always have the policy, if any doubt, any discomfort there, stay on them. If you're not getting any adverse events, what's another 3, 4, 5 weeks? It's not a problem.
Perfect. So cool. Yeah, I would agree with that. Yeah, so that's it really. We want to make sure they're loading it properly. So by that I mean putting the foot down when they're walking and doing it consistently. There's obviously like levels of how lame they might look post-operatively. So putting the foot down is a key first step, and then trying to normalize the stance duration, so how long they're spending on it and if it's equal to the other side. whether or not they're bending that knee as they're stepping it through, because often when it's really sore, once they've put it down, they'll kind of almost peg leg it. So we might start doing some kind of gentle cavaletti work, which is poles on the floor and walking over them, but that would be kind of carefully observed and looking at how they're doing it and keeping it really low. I'm not in a hurry to get them hoiking that knee up as far as they can whilst they're walking.
I think that's a really good point to point out to people. I've seen this multiple times where people buy cavalettis online and they go it alone and
this high off the ground.
I know, and they turn it into gym
like a wetsuit.
You're like, no, low and slow.
Yeah, absolutely.
Cool.
Because the flight arc in a walk isn't that high anyway. It doesn't need to be super high.
No, we're not.
And then it really depends on how comfortable that dog is, if there's any swelling, what the joint range of motion is like, as to how quickly I progress through an exercise program. But I think the key is that we always kind of work in tandem with the referring vets and making sure that we're not overloading it, and then monitoring that dog for whether or not it causes any flares. And then just continuing with electrotherapy and manual therapy to stay on top of any secondary compensations. So like I said earlier, the hip flexors can get really tight. And one hip flexor, your rectus femoris muscle, which is one of the quadriceps, it flexes the hip up, but it also extends the knee, so straightens the knee. And if that is really tight, it can inhibit how much bend we get. So just trying to maintain really nice muscle mobility on the front of the thigh means we're more likely to get more bend in the stifle as well.
Amazing. And that's something that I was going to quickly get you to just say is, if you're an owner that does want to do more manual work, do you encourage that? You know, an owner that wants to massage and...
No.
Probably
not. Do I? No, I don't think I do. I think massage. So if you're doing like gentle kind of effleurage, so just gentle massage, and the dog tolerates it well, then yes, that's fine. But I don't think I'd be encouraging any kind of deep kneading or joint mobilizations. And I don't know if that's just because I'm quite cautious as a practitioner, but I think when you are mobilizing, especially the stifle joint, because it would be kind of quite open chain and you've got the weight of the rest of the limb on it, depending on how big the dog is, but you need to be quite supportive of that joint as you're mobilizing it. And I don't know, I guess we have those kind of handling skills, and I just don't want to put that onus on the owner.
Would you allow them to massage areas distant, so compensatory areas, maybe lower back into the neck and stuff like that? Are you happy with that? So there you go, owners. If you're one of these people, and I often have people say, what else can I do? You know, that's their bond. They want to spend time with their dog. They've had their walks reduced from 45 minutes twice a day down to 10. You know, you've got 35 minutes twice a day to spend with your dog, and you want it to be quality relationship. Cool.
Yeah, that's nice. I think the exercises as well are a really nice engagement activity for your dog, because your dog is learning a new skill, is getting rewarded for it 9 times out of 10.
Yes.
And it's a really positive engagement activity for you to do. So as well as the rehab, it's quite, that's another kind of enrichment activity that you are doing.
I think it overlaps massively into osteoarthritis management. Like you said right at the beginning, there's so much that we say the same, and trying to get owners of arthritic dogs to realize that low impact engaged activity, even just in the home garden, to that dog is as good as a walk around the block. You know, they've got your attention, your time, and you get to do things that are going to weight shift their body, and you're going to be doing strengthening and proprioceptive work. Okay, it's in the garden. So what? You still have amazing time with your dog, and that's what we all want, surely. So, don't be put off that you can't walk a hike anymore. You can still have that brilliant relationship. And our phrase is, arthritis is not the end of the road. It's just the start of a new direction. And it's so, so true.
Yeah.
So we've just got a couple of questions. Water treadmill, good or bad?
So I think for a conservatively managed cruciate, I would say bad. I don't know if that's controversial or not, but it goes back to that not being able to stabilize, struggling to stabilize it through swing, but really struggling to stabilize it through stance. And even in a strong limb with an unstable stifle, I think that's really hard. So if you've got them in the water treadmill and the belt isn't moving and you're doing some proprioceptive stuff and some weight shifts, maybe some exercises, fine.
Yeah.
But I wouldn't get them I wouldn't get them walking against resistance with an unstable stifle. I think that's just going to flare everything up.
And I guess it would also overwork those hip flexors more, wouldn't it? Pushing against the resistance.
Yeah, massively. For a post-op, I think it can be great, but it has to be at the right time.
Yeah, and that's again an area of contention, because I remember some orthopedic surgeons being quite happy as soon as the sutures have healed, you know, the skin wound is healed, so as early as like 2 weeks in like joint modified, so the TPOs, etc., because you've changed the plateau angle, so you're going to have that stability on placement. And I can remember it was the University of Tennessee were like, we've started being quite proactive and we're getting quite good results. But I didn't follow that up. Is that still the case, or is it wait?
I don't know about Tennessee. I don't think there are many that are referred that early to treadmill here. So I know some of the orthopedic surgeons that we work reasonably closely with wouldn't refer to hydro in the first few weeks, and then I think it tends to be kind of us liaising with them at a point when we think it's appropriate and saying, would you be happy for them to do it now? And at that point, they tend to be. So I think it is something, it depends on the dog, and it depends on whether or not there are any complications like meniscal tears or associated ligament injuries. But if they're moving reasonably well on land, they're stabilizing quite nicely, and they're starting to build up some reasonable muscle tone, then I think it's a nice thing to do, but it just needs to be sort of kind of carefully monitored, because they could still flare.
Yeah, absolutely. And I think there is a belief that if it's in water, it's always going to be safe. And I think people really need to realize that it can be quite a dangerous environment. You know, you're asking the body to work pretty hard. So definitely making sure that you not only physio, vet, orthopedic surgeon, but also find hydrotherapy centre that have got appropriate training, appropriate regulation, appropriate assurance. They know what they're doing is really important as well, isn't it?
Definitely. And I think as well, it depends on what that dog's going to be doing. So if you've got like a dog with a cruciate injury and the goal is to get them back to agility, then fine, let's do hydro and let's get them as strong as we can get them. And that's quite a drastic case. But if you've got a dog who you know, like say the young Labrador who wants to get back to running around off lead, maybe do a bit of getting in and out of rivers, then you do want to start introducing that in a supported environment, because it's an activity that they're likely to do. If they're going to fail at that activity, you'd rather know why that happened in a kind of controlled environment rather than.
Yeah, no, totally agree. So with the ones that have had surgery and they come to see you, are they going to continue to see you, or does surgery mean that they never have to come back and see the physio after a short post-operative course? This is primed, obviously. I know what your answer is going to be, but I think there's a lot of people that do it as a checklist. I've had the surgery, check, I've had my 12 weeks rehab, I'm done, never go back. What's your thoughts on that?
Yeah, so we don't use timeframes like that necessarily for when we're done with rehab. It's more about those kind of physical objective milestones, as well as the soft tissue healing times as well. But you want to start reintroducing how much exercise they're doing, and then at each stage, how well are they coping with that? And we use the stance analysis to monitor how much weight bearing they've got going on those hind limbs, because like you said earlier, if they're offloading that operated leg, the risk of the other one going is super high. So we've got some really nice tools, as well as checking how comfortable they are with us manipulating the joint and whether or not there's any soft tissue pain or restrictions higher up. We can also look at that weight bearing. Is it even, is it not? And we can kind of use that to see where they're at in terms of that rehab. And probably wouldn't sign off a dog that was still asymmetrical. And that doesn't mean we're seeing it every week. That means they have a program they're working on. They have a certain amount of exercise that they're doing. They've got a couple of tools to manage some soft tissue soreness and things. And then maybe we'd see them monthly for a bit just to make sure everything's still going in the right direction. Because if the surgery has been successful, they should have a good outcome if they're rehabbed properly. Would you agree with that?
Yeah, no, absolutely.
So we need to make sure we get them back to 100%. And as they progress with the rehab, those deficiencies become much more subtle. And I actually almost think that that's where we are more useful, because we can see those subtle deficiencies that the owners won't see, because actually the dog's looking pretty good at that point.
Yeah, and I think there's a real tendency for people to go, oh, well, that's probably as good as it's going to get. And I think having a check-in with you guys and you know, with your experience might be, way nay, you know, that is not as good as we're going to get. We've got way more we can do with this. You know, there's a real discrepancy between muscle mass. There's a real discrepancy between loading. You know, there's an effusion there. So we're not where we should be. So I definitely would encourage people, no matter whether they're conservative or surgically managed, if you can get into your diary that, like with your veterinary health checks once a year, try and have a check-in with a physio maybe twice a year, and, you know, how am I doing? Because unfortunately, once they've had an injury like this, you've got to consider it for the rest of life. It doesn't stop their life, but it's something that you do need to consider. And a lot of people see that as bearer of bad news, but
it could be really positive, because if we can pick up subtle changes that mean that they stop offloading the other leg, it's preventative. We're stopping them from having significant joint pain in the operated leg, maybe significant injury in the other side.
Definitely. There was one other question. I'm not ignoring you, lovely person. Where are you, Facebook user? Well, somebody would like to know if your hypermobility paper is available for anybody to read. That's I like that, people being interested.
That's a good question. It isn't published. I'm trying to get it published.
Awesome. Well, when it is, you let us know, because it'd be good to be able to share stuff like that.
Yeah.
And then, do you have any experience with PRP stem cell and physiotherapy management of cruciate? No, it's not common.
I did read a good paper about using it for partial cruciate ruptures and the results they have with that, which look brilliant. But I think that was in cruciates with less than 50% fibre rupture. And I just don't think, I don't think I have seen those.
No. And I think what people have got to realise, the practicality of that, is that you've still got to have some kind of investigation to understand how bad the tear is. So say you did work on the principle, I'm going to do it with partial ruptures as long as they've got less than 50%. How do you find that out? Well, pin scoping, MRIing, what are you going to do to be in that category? So if you're anaesthetising them to do that, you know, is it a wise move to actually go and surgically stabilise? So I know that orthopaedic surgeons that I've spoken to, we've got to consider the cause of the cruciate degeneration. And if it is due to the mechanical forces being placed upon it, it doesn't matter how much biological you throw at it, the mechanical forces are still there, aren't they?
That's interesting. Yeah, it's a good point.
Well, I think it's really interesting, because you read these things and you've got to think of the practicality of, well, you know, how do you know how much tear?
And I guess the benefits of it are that it could be less invasive, potentially less costly, less risk of infection and things. But thinking about the long-term outcome of that, if you've got a dog whose risk factors are high, then actually stabilising the stifle might give you the best outcome. But I haven't, honestly, I don't know of a case where I've seen it used for cruciate ruptures. So I'm sorry, I don't know.
No, it's fine. And I think I have to read the paper again. I don't think they followed them long term. So whether they eventually long term,
was it 8 to 12 months or something?
Yeah, exactly. So what's happened to them at 2 years, 4 years, 10 years? And that's not their fault. Like, the study's brilliant. The study's brilliant that we're investigating stuff. But I think we have to realise that there is a longer term project that needs to be followed.
Yeah, definitely.
Lovely. We've done an hour and people will start to fade. So I'm going to say thank you. Has anybody got any more questions before we go? Amy has given me the nicest news today that she's going to help me more with Cam. She's going to come and do some more live, hopefully. And I think you're brilliant on camera. You're really, really beautifully spoken and very clear and eloquent. So hopefully we can tackle some other topics. Maybe even think about talking about patella luxation, which I don't think gets enough attention. You guys are really good at managing those sorts of situations as well, aren't you?
Really good at managing those.
Yeah, and I think that would be a really nice one. It's another one of those diseases I don't feel gets enough attention, really.
And it's quite interesting and a bit controversial in how we manage it, isn't it? So yeah, no, that would be fun. Let's do that.
And then maybe, because I'm going to put you on the spot now, we could do like lumbosacral disease and keeping lower back strength because of mine.
Yeah, I probably will back that one over to my boss, actually, because that's her baby.
Is it? Amazing.
It is,
Amazing, because I think lumbosacral is a really interesting one. Again, I think it's a disease that gets picked up quite late. And
yeah, definitely. And I think the signs are there for a lot longer than they are necessarily noticed.
Yeah, I want more people to know the amazing work that these physios do. So thank you so much for listening, guys. I'm really, really grateful to Amy for coming and sharing her experience and her knowledge with us. If you do have topics that you want us to bring up, we are looking at getting our guest speakers in for 2022 and 2023. We're planning way 6-12 months ahead, so get your topics in. Please sign up for the big walk. I can't tell you how much work is going into this. It's insane.
We're going to check out.
Yes, you need to. And thank you to our sponsors. I'd like to say thank you to Big Barker, Floors for Paws. We've got Norbrook, Curacor, we've got Vet Plus. We've got many companies that are beginning to step forward and support us, but there's always room for more. So if you are interested in becoming a sponsor, let us know. Please join up to the member zone that launched about a month ago. So that's £25 for the year to go and get all of these CAM resources. So please go and join that as well. We're back on Thursday, so we will see you then. Until then, goodbye.
Bye.